You're listening to the Smith House Adventure Show. Can you tell me about your volunteer work in Nicaragua?
Yeah. So after first year of medical school, we had the opportunity, and a bunch of my classmates at that time took that opportunity. And we went down to Nicaragua and helped in a nonprofit clinic on the island of Ometepe. And so there was actually 20 of us that went down, and we split up into groups, and there was like a licensed naturopathic doctor working with us. And we saw patients that were from, that had no money to actually get the health care, but we were offering this care as a student clinic. And it was everything from like somebody coming in with like a bladder infection to somebody actually having a broken foot that they had an x-ray, but, had sat all day in the burning hot sun to see us as a doctor to get, supplements, or to, help with their diabetes and to work on blood sugar control, or somebody had an ear infection, somebody needed a pelvic exam, right? Somebody needed a pregnancy test, right? Like all these things that they don't usually have access to, depending on where they lived in Nicaragua. And then they were able to come see us. And so we did, I think we were there 4 or 5 days working in the clinic. And then a bunch of us stayed in Nicaragua longer and toured around. But yeah, it was so rewarding to be able to actually see these people that are, and I probably say it was one of my favorite places to travel. These patients literally have nothing, right? Very little, they're working 12 hours, in a coffee field or, other kind of plantation. But they were just so it really gave me a new aspect, appreciation for life. And, they had really nothing except, their mud roofs on houses, and they were so happy. And it just gave such a different outlook than we see here, where we have more income than they do in Nicaragua. And, but I loved the people. They were so happy. I climbed volcanoes. I helped patients, naturopathically. We were even just doing like physical exams, listening to their heart, listening to their lungs, right? Doing palpation of like the abdomen. And so it really got our clinical skills up, as well as being able to help these patients and get some care that they wouldn't have otherwise got to get.
That is amazing. And would you say that's one of did you get a better appreciation how you live in a Western nation, Canada, as opposed seeing people who, that's it. They work brutal long hours for barely anything. And they're going home to something that's probably leading to their health being problems too, with bad roof, everything like that, whatever, and just the bugs and insects. How quickly did your eyes open to seeing the other side of living?
Yeah, and it was very eye-opening, but I absolutely loved it. And it made me so happy to volunteer. And, I had 1 year of medical school under my belt at that point, so we were working in groups, and there was 4 of us and a doctor. And so we were all also learning from each other, or we had a bunch of supplies that were donated that were shipped down. And so, something that I may have prescribed here in Canada, we may not have had, it wasn't donated, or, everybody needed it and we didn't have it in the clinic, but other ways to what else could we kind of pull together to help these patients? And they were just so grateful. I loved it. And then just traveling around and just seeing how they live. My friend and I, we stayed in every local hostel we could, and we rode their chicken buses. So there was animals. It was their public transport. And then, there was a pig on the bus, and there was a chicken in a cage on the bus, and and you're going down a dirt road. And I was like, man, this is, I'm fortunate to have these opportunities of going to medical school here in Canada. But I also loved, helping patients that wouldn't actually get that care, and they were so happy to have it. Even just it's also about that like connection and like physical touch with a patient. Like as soon as you're able to put your hands on a patient to help them, whether it be they're saying something in a completely different language or pointing at where it was sore, as soon as you are able to put your hands on it, there's that human connection and that transfer. And there was so much less hustle and bustle than there is in our world, where no one, like everyone in Nicaragua acknowledges everybody as you pass them. And I loved it. And then I come back here and I was like, no one says hi. So it was so different. I think it was such a great opportunity, and getting to see a different part of the world, and it wasn't a touristy place. Like we were in like a small island, right? It was a volcano island. So.
Thanks for your time. Please like, subscribe, and comment to help grow the show. And remember, get back up.